physios, I welcome you all to our channel Physio Vidyapit. We are back with our next lecture on microwave diathermy. So it's our last lecture and here we will be focusing on therapeutic effect, dosage, contraindication, danger as well as the precaution of microwave diathermy. So as you all know, my name is Vijay Kumar and let's just start the topic. Therapeutic effect. Okay, so the physiological effect of microwave diathermy was same as the shortwave diathermy, that is it was a we can say heating effect. Okay, also similar to pulse SWD, here is pulse MWD also, so which are more or less similar to each other. So first therapeutic effect is in the inflammatory condition. Okay, so in case of inflammatory condition we can use microwave diathermy, and here also in acute condition we will be using pulse microwave diathermy where we need less heating effect. While in case of the chronic conditions, we will be chronic inflammation, we will be using the we can say continuous microwave diathermy, which will be giving a heating effect, which will thereby cause vasodilatation, increase the blood flow and remove the noxious stimuli, and also help to reduce the inflammation. And its example include jumper's knee, okay, tennis elbow, sprain or strain. Similarly in traumatic condition, okay, here also in acute condition we will not use the continuous microwave diathermy. Why? Because its example is sports injury, na? And if it is acute and if we give the continuous microwave diathermy, it will exacerbate the condition or the symptom. So here we will be using pulse microwave diathermy. But in case of chronic sport injury where there is some sort of muscle stiffness also, then we can use the continuous microwave diathermy, and it is used in combination with stretching and mobilization for further or we can say more beneficial effects. Okay, arthritic condition in RA, here also MWD has been found to reduce the pain and swelling. Okay, reduce the pain and swelling. And also various studies showed that the microwave diathermy was better than even ultrasound. For the 1 megahertz ultrasound, it was better that we can use microwave diathermy in relation to that in case of inflammatory condition and traumatic condition. Then in pain relief, yes, so pain inhibition is done by that pain gate mechanism and due to increase in blood flow which will wash out the noxious stimuli. Also it can be used in low back pain. So these are very obvious indications of microwave diathermy. Next is dosage. Here also dosage depend upon the perception of heat by the patient. Okay, and the minimum dose is 20 milliwatt per centimeter square, because after this only the therapeutic effect will occur. Why? Because minimum this dosage is required for a heating effect, and it can be done for 20 minutes or for deep tissues for 30 minutes. Okay, next is the contraindication. They are very obvious contraindication of any heating modality. Diminished or reduced thermal sensation. If we will give microwave diathermy, it can cause burn. Defective arterial circulation, if initially the blood supply is not good and we will increase the temperature, what will occur? Van 't Hoff law, increase in the temperature will increase the metabolism, but the blood supply is not able to meet that demand, so problem will occur. Recent hemorrhage, it can increase the bleeding. Metal in the area under treatment, definitely it can cause heating in the metal. Malignancy, okay, malignancy, it can spread the malignancy, also it can spread the infection. Then implanted cardiac pacemakers, it can interfere with it. Why? Because microwave are a radiation and that can interfere with this pacemaker. Eyes and testis also on pregnant uterus. Okay, so these are the contraindication. Now we will study about the dangers. Okay, first is burns due to overdosage. Okay, second is exacerbation of symptom. This will occur if we will apply microwave diathermy, that is continuous one on a acute condition. Cardiac pacemaker, infection and malignancy both can be spread out. Then pregnancy, definitely these radiations will be having a bad effect on the developing fetus. Then damage to eyes, damage to equipment. Why? Because if there is some sort of metal, then that metal will reflect the microwave back into the emitter, which will be damaging for our equipment. Okay, next is precipitation of gangrene. Okay, so the area where blood supply is already reduced, if we will give microwave at that part, it will increase the temperature. Why? Because this one is a heating modality. So due to that heating, the metabolic demand will increase, but it cannot be meet out if there is any defect in blood circulation that can cause gangrene. Okay, that can cause gangrene, and either it can be arterial or venous. Okay, so that is different thing. Next is the precaution. Okay, so in simple words we can say we need to stand. If we want to stand at the front end, we need to stand 1 meter away. Why? Because in that 1 meter radius, the radiations of the microwave are very high, which can be, we can say, bad for us. Also, if we want to stand behind it, we should be 20 centimeter away from the behind also. Okay, so this one is the precaution. Okay, so this is whole about the third and the last lecture on microwave diathermy. With this, we are completing the microwave diathermy. So soon we will meet with the new topic. So till then, you keep on studying. Thank you to one and all.